So welcome everyone. Here we are, 1st of July, the new ICS. It's so great to be able to see you all today and just to thank you for all the work that you've done over the last few years as part of the CCG. But also as we move into this new world of ICSs, I'm so proud and pleased to be able to be here with you, and I know what a fantastic team you are. And what I would like to do today is to just give you an opportunity to hear from our chair about the work that we're going to be doing over the coming years.
Thank you very much for joining us today on the 1st of July. It's the day on which the South West London ICS becomes a statutory body. So I'd like to start by thanking you very much for all the work that you've done in getting us to this day, especially as I know that you've been doing that whilst you've been doing your day job in looking after patients and the residents of South West London in these very, very challenging times. The ICS starts today. We've been set up by the Health and Care Act, and we've been given very specific responsibilities. First of all, we need to ensure that we deal with improving healthcare of our population in every way that we can. Secondly, we need to reduce inequalities of treatment, of access, of experiences. Thirdly, we absolutely have to have laser-like focus on productivity and value for money. And lastly, and this is relatively new, we need to play our part in the social and economic well-being of the boroughs in which we live. So as you can already see, the objectives of the ICS are quite different from those of the CCG. In particular, there's one really significant difference, is that we've been asked to achieve all this through collaboration, through working with our partners. Fortunately, in South West London, we have a very good start. We work very well with our partners. You worked very well with the partners during COVID, so you know how to do it. And what we are now going to have to do is for that to be the way of life. We work with our partners all the time. So we have very close relationships with all our 6 local authorities, with all of our providers, the acute providers, the mental health providers, the specialist providers, and the community providers. We work very well with Health Watch, particularly working with them to understand our patients' needs, and also with a number of voluntary sector organisations. So we're starting from a very good base. And what we have to do is to continue to improve that, crucially for the benefit of our residents and all of our patients. So today is the beginning of a big day, beginning of a big era, and I'm sure you'll join me in looking forward to South West London ICS going from good to better, from good to excellent. So thank you very much for listening.